All right, so this is perhaps the last part of the female reproductive system that we are looking at. So now we're going to focus on the mammary gland, or the breast, if you like. So remember to say the breast is simply specialized skin. So this is a skin. Regardless to say, both males and females have breasts, except that in females, the breast tissue, or what you can call the breast organ, is well developed. Okay, the breast tissue is well developed in females because of, number one, the X chromosome, number two, the type of hormones that women produce. So these hormones, they're at puberty, stimulate development or maturation of the mammary glands that we call the breasts. In addition to that, during utero, both male and female babies, the breast tissue develop in a similar fashion. That is to say, these tissues, first of all, develop in a line here, that is the mid-clavicular line. There's a line, this is here, somewhere here, there's a clavicle bone connecting the shoulder to the sternum there. So if you draw a line at midpoint of the clavicle, we call that as a mid-clavicular line. During development of the fetus, whether male or female, there's what we call the mammary line. The mammary line is in the same plane with the mid-clavicular line, somewhere here. Now, we'll see that breast tissue develop in the lower part of the abdomen, closer to the inguinal region. But these breasts develop on the same line, like that. So breasts begin somewhere below here, then keep ascending. So the one that is below undergo degeneration before we are born. Then the next breast appears again somewhere closer or next to the umbilicus. So it is simply ascending. Then as a fetus develops, that again degenerates. Thereafter, another breast tissue is seen to develop just below the rib cage there, what we call the subcostal line. That one also degenerates until the breast tissue develops around the fifth intercostal space. That will be the final breast that will develop into the breast of the male and the female. Now, some breast tissue may follow that line and actually develop slightly higher than where we expect the normal breast to be found. So you see that that mammary line is sometimes equated to the alignment of breast tissue in other organisms. For example, dogs, cat, pig, and so on and so forth. You see that they have more than one breast, maybe 8 this side, 8 on the other side, or maybe 4, 4, or 3, 3. But you see that all of those breasts are in the same plane or in the same line. That is how they develop in human beings. But since we are humans, those early breast tissue, they will disappear, and only 2 breast tissue will remain at birth. Okay. Therefore, you should not be surprised when you find that a newborn baby, for example, you're working from the labor ward and you deliver a baby, and this baby may have more than 2 nipples, and those nipples are representing the breast tissue. So we call it supernumerary breast. Super meaning more, numerary number. So more than the normal number of breast tissue can be found in a newborn baby. So it shouldn't be something that will lead people questioning whether it is witchcraft or something. These are processes that may persist instead of the early breast tissue to degenerate, they may persist on and remain as such. Therefore, such findings can be found on physical examination when you're examining a newborn baby. Away from that, we're saying the breast is developed skin. What about if you peel off that skin? What other tissue are going to find in the breast tissue? So this tissue are going to describe histological tissues as well as gross tissues. So you see that the similar tissues are found in males, but they are not as developed as in females. Okay, so first of all, there is skin. All breast tissue is covered in skin. So that is the skin you are seeing there. Next is that the breast has the body. This is a body that you are seeing, or the mass of the breast itself. This is a body. In addition, the breast has a tail. So this is the tail of the breast. So the breast goes all the way closer to the axilla. You can see those lobules. These are lobules of the breast tissue and slightly go into the axilla. So when you're palpating a breast tissue, especially when you're examining a female, for example, you're trying to screen for breast cancer, you see that the breast does not just end here where it is swollen or massive. The breast extends in the axilla. We call that as a tail of the breast. Then this is a body of the breast. In addition, you see that the breast has a nipple. This is the centralmost part of the breast. That is a nipple, and that is the protruding part of the breast. Or we can call it the anteriormost part of the breast. In that nipple, there are multiple openings, small openings that become patent when the woman is about to deliver or when the woman gets pregnant, because the breast tissue will develop, and sometimes some discharge can be seen from the nipple, like the breast is getting ready for lactation when finally this mother will deliver. So even though it appears solid here, you and I should know that there are multiple openings on the nipple there. Okay. And as you advance in age as females, you find that if you, depending at which stage of your menstrual cycle is, if you squeeze that, the nipple, sometimes some clear fluid can be expressed from there. It's not an abnormal finding, unless maybe there is some pus coming out or maybe blood. Then therefore it should now concern you. But clear fluid is not really a serious concern. Away from that, the nipple is surrounded by the areola. So that is areola, which is a darkened or pigmented area of the breast. Depending on the skin tone, the pigmentation varies, but in Africans, usually it is darker. So the areola is darker. In other races, the color may be variable. The areola becomes more darker during pregnancy. So when the woman conceives, the areola becomes even more darker. That is under the influence of hormones of pregnancy. Estrogen and progesterone makes this area more darker. So that is areola. This is a nipple. Okay. Now, if you dissect the breast, you cut it like that. Let's see what is found underneath. So we are now viewing the breast from the lateral view. So that is your skin. And be reminded that skin all the time is covered with or is followed by superficial and then deep fascia. Superficial fascia is always fat in nature. Deep fascia is dense connective tissue. We explained or we discussed this when we were talking about connective tissue. Even when we talked about muscles and tendons, I explained the differences between the two types of fascia that we expect in the body. So that is skin, and then this is fascia now, the fat that we are seeing. So this is seen in female breast. Male breast, there isn't so much fat, so the breast is quite smaller in size. Then the mass of the breast, apart from being adipose tissue like you are seeing there, the core of the breast is gland. So it is a glandular tissue. You can see glands there, okay? And we discussed what type of gland it is, okay? When we're discussing about compound branched acinar glands, these are the glands that we're talking about. Compound branched acinar glands are the breast. We also mentioned to say apocrine glands. breasts secrete by apocrine means, where the apical part of the cells pinch off together with the product that this gland is about to secrete, and then follow through ducts. So within the breast, we are going to find two types of ducts. Let me use this diagram to explain that in detail. So what we are seeing here, those brownish elements, that is the actual breast where the milk product will come from. Then we have fat there, which is just providing the necessary nutrients that these cells will need and energy to produce the milk. So the functional part of the breast is this granular part. Now, this granular part is divided into lobules. So we have a lobule like that. Let's see them here. Okay. So these are lobules, small sacs, more like, sacs. And those sacs are acini in shape. Remember, acini is cup-like shape. Then these small sacs, if you lump them in one, they give us what we call a lobe. So a breast has lobules and lobes. So this is one lobe, lobe. Then within a lobe, you find multiple lobules. And each lobule is simply an acina, a cup-like structure, as you can see there. So from each acina, or from each lobule, there's a small duct. So let's say we have 500 lobules. We expect 500 ducts. Then eventually we'll need one duct to leave that lobe. So this is one lobe, then this is one duct. So all these small ducts connecting to the lobules are finally going to form one single duct. And that duct leaves as a lobar duct, or a lobe duct, if you like. It is also known as lactiferous duct. So a lactiferous duct is a duct of one lobe. This is one lobe, another lobe, another lobe. So all these small sacs will eventually pour their product into the lactiferous ducts. Now, lactiferous ducts from each lobe will eventually meet at the nipple. That's why the nipple is extended or projected forward, because it has so many ducts terminating there. So each duct, the lactiferous duct, forms a sinus, like a pool, if you like, where milk will collect there, and then the baby can suck it from there. So we call this as the lactiferous sinus and ampulla. This is an ampulla where all these lactiferous ducts from different lobes will eventually meet. Then small openings now will connect the sinuses to the external environment of the nipple. And that's where the baby will get the milk from. So in summary, the functional part of the breast is glandular tissue. This glandular tissue is compound branched acini gland. Thereafter, we are saying these acini have small ducts. Then these acini at the same time are referred to as lobules. Thereafter, multiple lobules combine to form a single lobe like this one. Then one duct drains the lobe, and then forms a sinus at the nipple. Okay, so that is the breast. Now, in addition, this breast, you can see that underneath the skin, there's a lot of adipose tissue. Like I was saying, this is seen in females. Then posterior to the functional part of the breast, or the parenchyma, we have a layer of fascia now. If you see, this is deep fascia. It doesn't look like fat. This is now membrane. It's grayish in color here. So this is dense connective tissue, whereas this one is loose connective tissue in form of adipose tissue. So this is superficial fascia. This is deep fascia. Then underneath this fascia, we call it pectoral fascia because it covers the chest. The breasts are found on the chest. So that region of the chest is also known as a pectoris region. So that's why it's called pectoral fascia. underneath the pectoral fascia, you find muscles now. So mainly there are two types of muscles on the chest that we consider in relation to the breast. So we have the pectoral major muscle as well as the pectoral minor muscle. Okay, in males, these muscles are more prominent than the breast tissue itself. So the breast of a man is mainly muscle. What muscle is forming that breast? We call it the pectoralis major muscle. This is a pectoralis major muscle. There's another small muscle on the top layer of the breast there, known as pectoralis minor muscle. It's not shown in this picture, but even females have it, okay? But except that the volume is smaller. So that is the pectoralis major muscle. Then immediately underneath the pectoralis major muscle is now the intercostal muscles that we talked about. You and I now at this stage know the types of intercostal muscles that we have. There are three of them: external, internal, and innermost intercostal muscles, which are shown here. So when you're asked to draw the breast, you must also label those muscles: pectoralis major muscle and the intercostal muscles, plus the two layers of fascia: superficial fascia, which is simply adipose tissue; deep fascia, which is simply dense connective tissue. Now, you see that from the skin up to the deep fascia, which is simply dense regular connective tissue, there are these grayish lines. These are ligaments. So the breast is suspended. So it has suspensory ligaments of Cooper's. These are known as suspensory ligaments of Cooper's. They keep the breast firm and erect, or standing if you like. So as the volume of the breast increases, especially during pregnancy, you see that because of fat accumulation and growth of the lobules and the lobes of the breast becomes so big. So expect this woman after breastfeeding, maybe 2, 3, 4, 5 babies, the way the breast will be positioned is not as equal as a woman who has not yet breastfed or a woman who has not yet gotten pregnant before. Okay. Usually those women who have not breastfed, the breasts are more firm and more standing because of these ligaments. But with development of the breast and maturation during pregnancy, you find that a lot of fat goes in there, and therefore the breast cannot stand anymore like it was. Others is just genetics, because maybe your breast is tall, big. These ligaments cannot withstand the weight, and therefore you expect that the breast will be slightly slanting downwards. Again, others due to genetics, even after breastfeeding so many times, maybe 3, 4 children, still the breast remains firm and standing. Nevertheless, that shouldn't bother you so much. This is just simply skin that is specialized to produce milk in females. So suspensory ligaments, I've explained their function there. Okay. So what we have now in this diagram is a breast in different phases. So you can have a breast before pregnancy. We can have a breast in early pregnancy, and the breast during pregnancy, and the breast after pregnancy. So you have breast in that stages. So breasts reach maturation after puberty. Maturation begins at puberty, but around 20, 21, and so on, breasts are fully mature. But they are inactive because at that stage, a woman is not pregnant. Until a woman gets pregnant, then we can say the breast is now in a gravid state. So we have a pre-gravid state where it's a fully mature breast, but no pregnancy is available. So that breast has not yet been exposed to hormones of pregnancy. So we just call it mature but inactive breast. So you can see the difference there. The gland is there, but the lobules are not dilated. They're not swollen. They're not producing anything. So it's just inactive. Then you can now see the difference here. So the breast begins to grow after pregnancy. So this woman is now pregnant. As you can see, the size is different. early pregnancy. So at this stage, you find that the breast begins to feel a bit heavier for this woman. At the same time, the breast begin to feel tender because it's now being stimulated by hormones of pregnancy. So this is a breast in early pregnancy. Now, observe this difference. This is now a breast in mid-pregnancy. Look at the lobules, well-developed lobules. You can see those white and circular structures. So at this stage, the breast is now forming or producing milk, but it's not yet ejecting the milk. The milk is just being stored there until the fetus is born. As a baby now, who begin to suckle. Then what we have now here is a lactating breast. So see the size again. Here, of course, the lobules are present, but during lactation, you can observe that the lobules are well and fully grown during lactation. So even the volume, the size of the breast increases during lactation. You can't compare it to when this woman was not pregnant before. You can see the difference, this one and this one. So during lactation, the breast will reach their fullest size because there's milk there. And if the baby is not feeding frequently, you find that milk accumulates, and sometimes these sinuses and ducts can be blocked by the milk. Okay, and that may cause tenderness in the breast and even lead to some infection. And therefore, it's important that that baby must suckle and clear out the milk that is produced so that more milk can be produced by this breast. Then the last part we are seeing now is regression of the breast. This is after lactation. The baby has grown, it's no longer breastfeeding. Breasts again involute. They go back to pre-pregnancy stage. Okay. But you find that the amount of fat in it, the size of the lobules will not change. So the breast size and volume has increased there and then after breastfeeding for the first time. Then after menopause now, you see that the lobules, the number of lobules and the size of lobules degenerate or reduce in size. Therefore, you can't compare a postmenopausal woman breast and a woman who is in their breastfeeding or childbearing age. The breast of a woman in childbearing age is quite larger in volume, well developed. Then this woman enters menopause, the breast undergoes involution and degenerates. So what happens now is fat that was there is being replaced by collagen. Okay, so collagen begins to be deposited there. So under mammogram, I wish I had those images, you can differentiate if you can actually determine or approximate the age of a woman just by looking at a scan of the breast. Okay. A woman that is in their 45 going to 50, you see that there's a lot of collagen in their breast tissue. Those that are below, so we can say around 25 to 35, going closer to 40, much of their breast is well developed. You see granular breast. Then those that are less, you see that the granular part of the breast is small. Okay. And there's a lot of fat there. So the difference between this one who is younger and this one who is older, even though both have little of a gland, there are few lobes. The younger one, there is more fat there. The older one, there's more collagen fiber. Okay. That's how you differentiate them. Okay. The text is there. You can read for yourself. Otherwise, this is all about breasts. Needless to say, breast cancer now is a common phenomenon, especially here in Africa and Southern Africa, to be specific, Zambia included. More cases are being, treated about breast cancer, and you see that there are different types of breast cancer. Okay, and all of them, or different types, of course, require different types of intervention. We have simple mastectomy, radical and modified mastectomy. Of course, where breast tissue is removed, sometimes the underlying tissue is spared, like the pectoralis major muscle. In the radical one, including the muscles are removed as well, together with the breast tissue. And if available, a prosthesis can be put there just for cosmetic purposes. One important feature that is worth noting is presence of dimples on the surface of the breast. You can see the skin here. This is a normal skin on the breast. Now, if the skin on the breast appears like the cover of an orange with small, small dimples, that is known as peel the orange, or orange cover, or orange peel appearance, orange peel appearance. That's how the skin of the breast appears. That is an early sign of breast cancer and requires you to go to the hospital for further checkups. So females, you know that at least once a month, you must at least examine yourself for any possible lumps in your breast. Of course, the texture of the breast changes depending on which phase of your cycle you are in. So it's worth knowing your anatomy. Otherwise, this is where we end for today. We'll continue next time.